Are you looking for a way to lower your risk for diabetes? Well, the answer may be right with your primary care doctor. Our next insider explains.
You definitely start with your primary care doctor.
Okay.
The primary care doctor is in charge of screening your risk factors for diabetes.
And that screening involves what, if I may ask?
So every time a patient comes to our office, one of the things that we do is we weigh the patient and we calculate a parameter called the body mass index.
BMI.
The BMI. So the moment that we notice that the patient is overweight, that's one of the risk factors for diabetes. So if patients come every year for their annual physical, we can screen them every year for this risk factor, and we can start lifestyle modifications early on before diabetes is diagnosed.
Exactly. And now that you say before diabetes is diagnosed, listen to this. According to the American Diabetes Association and the American Heart Association, every 80 seconds, an adult in the U.S. is hospitalized for heart disease. Wow. And every 2 minutes, an adult with diabetes is hospitalized for stroke. Look at that. Every 2 minutes, hospitalized for stroke. I mean, these are pretty serious statistics. Correlation now between diabetes and heart disease, how do they go hand in hand?
Diabetes, you can almost consider it a heart disease equivalent.
Really?
Because it causes disease on your entire vascular system. So many patients think initially about, oh, my eyes can be affected with retinopathy or my kidneys, but diabetes is a disease that affects all your vascular system. So it can affect your coronary arteries and cause heart disease and heart attacks and also strokes.
Is there a type of heart disease, for example, that is more common with people that have diabetes?
Well, it is called coronary artery disease when you have buildup of plaque in your coronary arteries, because when sugars are elevated, that causes inflammation on your vascular system, and that inflammation in the coronary arteries causes the deposition of cholesterol and what we call plaque formation.
Right, which blocks the artery then, and then can cause, obviously,
heart attacks.
Heart attacks. What about when it comes to blood pressure, hypertension? Can you explain what exactly is the relation then to diabetes as well? Is there a correlation?
Well, the problem is that most patients with diabetes are overweight. And being overweight is also a risk factor for hypertension. But you can be a diabetic, and if you are not overweight, you may not have hypertension. However, there is a condition that we call the metabolic syndrome, which is what we see when a patient is overweight, and then they have prediabetes or diabetes, plus hypertension, plus dyslipidemia, which is a problem also with cholesterol and triglycerides. All
right, as we continue the conversation, in case you want to join in on the conversation, you can give us a call, toll-free number. I'm going to show you right now, 855-796-4475. So the CDC continues to report high rates of diabetes in the United States, as we said, 1 in 3. A condition that used to be associated with adults, this is amazing, is now commonly found in children. Let's take a look at the state of diabetes in the United States in 2017.
I mean, the numbers, ladies, are so staggering. Stephanie, what can you tell us about the National Diabetes Statistics Report?
Well, the numbers are just that. They're staggering. We know that 30 million Americans in our country are living with diabetes, and that's in addition to the 84 million people who are living with pre-diabetes, which means over 100 million people in our nation are living with either diabetes or pre-diabetes.
That's like 1/3 of the whole country.
That's right. That's right.
You know, when you start thinking about this and the medical cost involved in it, I mean, this is an epidemic that could be so incredibly expensive to us as a nation.
Well, diabetes is expensive, and it's not only the medical costs, but it's a number of costs, $245 billion. We cannot sustain that kind of trajectory, and it impacts our workforce. We need a healthy workforce for important productivity. We need a healthy military to defend our country.
As a mom, I was really alarmed to see the spike in the number of young children developing diabetes. Why is it more serious when you're diagnosed at a very young age?
Well, the longer you live with diabetes, it increases your likelihood of developing those complications. It really underscores even more why you've got to take good care all along the way. Important to help our children develop that good care early on, and certainly for everybody with diabetes to do all that you can to manage diabetes.
You know, you and I were talking about this. I know you treat obviously 18 and older, but the numbers with children is just really alarming and very sad. What is it? Lifestyle? Social media, they're not moving, the foods, all that, right?
Definitely. So prevention has to start with children because that's where they they learn their eating patterns. And definitely the combination of sedentarism with children being overweight is what leads then to teenagers with prediabetes and then adults with diabetes.
So preventable. So sad. We have a picture to show our viewers, and it's kind of like how they diagnose diabetes. Can you walk us through this, doctor, from maybe left to right? We do hear A1C a lot.
Yes, so now we have a very good parameter to diagnose and also manage diabetes called the A1C. So the A1C gives us an average of your sugars over the last 3 months. So it's a very comprehensive test because it doesn't matter what you ate the night before you did your labs or even if you forgot to fast that morning, because sometimes it happens. The A1C, like I tell my patients, it doesn't lie. It tells me what you've been doing for the last 3 months. So it is a very good parameter to diagnose prediabetes, which starts as an A1C of 5.7, also diabetes, which is 6.5. And then it also helps us keep patients at target. And we have different A1C targets depending on the age of the patient and their other risk factors.
Okay. The difference between type 1 and type 2, if you don't mind, because I know one is more serious than the other.
Yes, so when we're talking about diabetes being a preventable disease, we're mainly talking about type 2 diabetes, which is a condition in which patients' pancreas still produce insulin, but over time that production of insulin starts declining, so you get to the point where the insulin level is not enough to keep the sugars at a normal range. While in type 1 diabetes, which usually happen in children and young adults, your pancreas unfortunately doesn't produce any insulin at all. And those patients are insulin dependent.
So to watch the entire episode and get tips on nutrition and mindful exercises like music therapy, download the Health Channel app and search Primary Care.